Hello, everybody, and thank you for attending today's webinar on HIPAA Omnibus compliance. Today's session will focus on a critical area of this regarding business associate and vendor management. I'm Tom Leahy, Senior Vice President of Sales and Business Development with PolicyMedical, and I'm pleased to introduce our newest partner, Aegify. Aegify is a worldwide leader in security, compliance, and risk management software. Today's presenter, Anupam Sahai, is a co-founder and CEO of Aegify. He's a recognized expert in the areas of healthcare IT, cloud computing, security, and compliance. He holds 3 worldwide patents and has been published in several technical journals. He's also a featured speaker at many industry conferences. As you're all aware, new changes and regulations are putting more and more pressure on covered entities, business associates, and their downstream business associates to assure that they are compliant and secure with the critical PHI data that they're managing. This is putting more liability on the covered entities to make sure that their business associates are in compliance. Anupam will provide an overview of the session in terms of the changes that have taken place, and he'll be introducing to you today some very unique software that can help in managing this very difficult process. With that, I'm turning it over to Anupam, and thank you for attending.
Good morning and good afternoon, everybody. Very excited to be here. So in terms of the topic and the agenda that I will cover today, I will first talk about HIPAA Omnibus and its implications for medical businesses, whether you are a covered entity or a BA, business associate. We'll talk about that. And as Tom said, one of the key burning issues today is the management of BAs. And we will talk about what are the challenges there and what are the best practices that as a covered entity or a business associate you can use and be aware of the challenges and overcome them, and also have peace of mind to make sure ensuring that you've taken all the steps necessary. We'll also talk about Aegify, which is an automated tool for overall management of security, risk, and compliance. But today we will focus on the aspect related to business associate and vendor management. So we'll talk about Aegify, and at the end we will have Q&A. So we would encourage you to type in your questions as we are going along, and we will pick them up at the end of the session. So let's get started. So let's talk about HIPAA Omnibus and how it has changed the game for covered entities and business associates. So HIPAA Omnibus, as you might know, was enacted and put in place in September 2013, and it drew a lot of its inspiration from the HITECH Act that was enacted in 2009. And so HIPAA Omnibus is really the culmination of a number of things that were out there, discussed, and agreed to. So what does HIPAA Omnibus mean and imply? So the first big thing is that it brings into purview, certainly the covered entities were responsible and liable for HIPAA compliance, but with HIPAA Omnibus, now business associates and vendors are required to be compliant. Not only that, it's the shared responsibility of the covered entity and the BA to ensure that they are taking steps to protect and secure PHI information, which is really the high-level objective for HIPAA. And both the CE and BA have a shared responsibility and liability to ensure that. The enforcement from the federal and the state auditor generals, who are now authorized by the federal government to do the enforcement, to do audits. And the fines have gone up dramatically. Earlier, the maximum fine was up to $50,000 per year. Now it's up to $1.5 million per incident with no upper limit. So if you have have a breach or if you get audited and there are a number of things that were found to be in violation, especially if you do what is called willful neglect, then you could potentially be fined at the highest level, and it can stack up pretty easily. There is also potential criminal prosecution ability that the law provides in case there's some misrepresentation of facts. And recently there was a case where for meaningful use attestation, one of the CIOs was criminally prosecuted because they misrepresented certain facts. So this is for real. And the fines are kept by the HHS and OCR. So part of the funding of the proceeds of the agencies are achieved through these fines and impositions that are put on the covered entities and business associates. And there's also a whistleblower clause that allows whistleblowers to be incentivized to report this, report any misrepresentation or misdemeanor. So the law has been thought through and has been made very ironclad to ensure that all the entities, covered entities and business associates that handle PHI are within the purview of the law. There are new changes in the data breach notification requirements. So now if the breach involves more than 500 individuals, it's the responsibility of the covered entity and the BA to ensure that the government and the media and the customers involved are notified within 60 days of the breach happening. And at the end of the day, it's the covered entity's responsibility to report this to HHS, the Health and Human Services. By the way, OCR stands for Office of Civil Rights, which is the enforcement agency of HHS. And of course, the need for security risk analysis is required by law, wherein you are assessing regularly your organization's policies, procedures, technical and security mechanisms that are in place to ensure that you're protecting PHI information, the patient health information. So let's dive into it a little bit more. What do the implications mean, and what should covered entities and business associates do given the new reality of the law? So the first step is that let's define what's a BA, because sometimes this can be a little confusing. So the definition of a BA is pretty broad. Any business entity that handles PHI information or has access to PHI information is considered to be a business associate. So whether it's your lawyer, your EMR provider, your tax accountant, garbage disposal entity, if they handle PHI information, all of them are business associates. And typically a covered entity would have many business associates ranging from, let's say, 10 in number at the smaller size level to hundreds of BAs at the higher end. So all of these BAs, and there are about 1.2 million BAs in the US that fall under the law. I just want to reinforce that the healthcare audits and the breaches are very real. And if you look at the 2014 statistics, roughly about 40% of the breaches that took place were targeting healthcare. And that's primarily because the healthcare breaches are the most valuable. So PHI information is the most valuable in the underground market. Whether we like it or not, that's the reality. And yes, there is a underground Amazon marketplace like marketplace where healthcare records are sold and bought. So this is these breaches affect both small businesses all the way to large enterprises, and so year over year these breaches are growing at the rate of 100% year over year, and so the breaches are really getting very aggressive. The attackers are getting very sophisticated. They have very sophisticated tools, but they're very organized. So it's important to assume that that breaches will happen and that you have to take steps to ensure protection and security of PHI. And that's where HIPAA will help you greatly. So I already mentioned that HIPAA is the law. It's also required for meaningful use attestation, which is part of the federal stimulus money, where the government provides to help you deploy electronic medical records. But one requirement there is to do a HIPAA security risk analysis, which is part of the HIPAA law. So the government is using a combination of a carrot and a stick principle to ensure that that you're following the law. And OCR has already declared that they will follow a policy similar to what IRS does, where they will roughly randomly audit 5% of the organizations, both covered entities and BA. So we need to be prepared as an industry to ensure that we are compliant and that we can document and be ready for an audit. So what are the challenges? Let's talk about that. I mentioned that now there is a shared responsibility and liability. Now that is the beginning statement, but what it means is that as a covered entity, if you have a business associate that's a downstream entity, you are responsible if a BA gets breached. As a covered entity, you will be held responsible and liable, because if the BA gets breached, they lost the information that was shared by you as a covered entity, and this is part of the law. So the risk liability extends downstream to all the entities. Similarly, if you're a BA and you're sharing information with any downstream BA or subcontractor, the BA and the covered entity, upstream covered entity, are all responsible. So there's a risk and liability chain that extends from the covered entity down to all the entities in the liability chain. And so it's no longer sufficient to say that it's a BA's problem, and the covered entities have to be proactive and manage the whole process. So let me just pause here and see whether let's do the survey if we can, Alex, and before we move on to this particular slide. So you'll see a poll on your screen that that's asking you a question around how many of you use. Okay, you want to go ahead and state the poll options, Alex?
Yeah, no problem. So the options are Excel spreadsheets, commercially available tool, paper, folders, or binders, or the fourth answer is you don't know. And so far the results that are in are 67% of people use Excel spreadsheets and 33% of people use commercially available tools.
Okay, very good. So let's close the poll. And so as was reflected from the survey, the way to manage BAs and vendors is very manual. But I'll talk about the steps that need to be taken to ensure that as a covered entity or as a business associate, you're taking the right steps. So the first thing, obviously, is to make sure that you identify all the business associate and vendors that you work with. And the starting point is to put together a business associate agreement, which is HIPAA Omnibus compliant. So HIPAA Omnibus, as I said earlier, expanded the responsibility for BAs and the subcontractors in terms of how they safeguard PHI information. So having, and that requires that every BA and vendor needs to have a risk management program in place. They need to be aware of how the PHI information can be used and disclosed. There are certain restrictions in terms of if it is going to be used for any marketing purposes, that needs to be approved by the customer. So it needs to flow upstream to the covered entity and to the customer before it can be disclosed. So there are lots of requirements there. And then, of course, breach notification is a key requirement where the BAs and the vendors need to agree that if a breach happens, they will report it to the HHS or to the upstream covered entity or BA as relevant. Now, earlier you could have a business associate agreement with your BAs and really shift the blame and the burden to the BA if you are a covered entity. But with HIPAA Omnibus, that's no longer possible. So putting a BA agreement in place is the first step, but the covered entities and BAs have to take further steps to be proactive to ensure that all the BAs and vendors are indeed HIPAA compliant. If need be, they can audit them and to ensure to get proof that these that all the BAs and vendors are compliant. So BA agreement is one step, but not the complete step. So the proof of compliance has to be made available or should be made available to the covered entity so that you can then be proactive in assessing and managing the risk. And of course, ensuring that the breach notification plan is put in place across the board. And once the assessment is done, it's a good starting point, but things change very fast. If there are new threats and vulnerabilities that are discovered every day, there might be organizational changes with new employees coming and leaving. So there's a need to continuously monitor the HIPAA certification status for all BAs and vendors. So if you're a covered entity, you want to do that, and if you're a business associate, the same applies for any downstream business associates and vendors. And if for whatever reasons, if a breach happens, the best thing to do is to do risk mitigation, to report it to HHS. Earlier, there was the harm clause that was removed or pretty much minimized in the HIPAA Omnibus law. So if you get breached, the first thing to do is to report to HHS, and then once you do the risk analysis, you can figure out whether there's material impact or not. And this is very important because if you look at the HHS statistics, about 30 to 50% of the breaches happen due to business associates and vendors. So this is a real problem. And when we were recently attending a conference on compliance issues, SCCA, in fact, in April, the OIG, the Office of Inspector General, mentioned BA-related breaches to be one of the top concerns that they've found, along with risk analysis and a few others. But business associate BA management was one of the top nagging issues that current businesses are not doing as well as they could. So if you want to put this in the context of certification, so whether you're a covered entity or a business associate, to meet the HIPAA certification requirements, there are a number of underlying requirements that need to fall in place. So there needs to be a complete HIPAA assessment done. There needs to be security scanning done for all PHI assets, all IT assets that handle PHI information, and they need to be scanned for vulnerabilities to ensure that they're kept up to date, they cannot be compromised by hackers. And risk analysis is really telling you the overall sum total of the complete organization's exposure or the liability exposure. And so risk analysis is very important to prioritize and focus on the most important issues that affect you as an organization. So it's something that you want to do very often. And then finally, BA and vendor management. This is another key requirement, because if you're a covered entity or a business associate, your risk exposure is the sum total of your internal organization's risk posture and also the risk exposure caused by downstream BAs who may or may not be compliant. So as an organization, you have to assess and take into account your environmental risk, which is coming from the business associates and vendors. And this is also required for meaningful use attestation. As I said earlier, it's important that you do risk analysis and meet all the HIPAA compliance certification needs to be able to attest and get the meaningful use dollars from the government. So when we set out to design the Aegify Business Associate Manager, our objective was to automate the entire process and process for managing your business associates and vendor. And we're going to be launching this service. This is out there. We've already announced it. And this automates the entire process of from starting to end of managing your BAs, getting proactive about knowing where their HIPAA certification status is, and then monitoring it continuously after that to ensure that they are keeping up with the changes that happen. So the process is very simple. You invite a set of business associates and vendors to uh, provide their HIPAA certification status. The business associates and vendors get an email notification, and I'll show you a quick demo which shows you these steps in a very succinct fashion. So once the BAs and vendors get an email notification, if they are already compliant, which they could be using any consultants or any other tools, they can upload the business associate agreement and the HIPAA certification status. And so the covered entity knows that they are compliant. If they're not certified, then they can follow a wizard-based approach provided by Aegify to achieve that. And one way or the other, the covered entity knows the exact status for every business associate and vendor. And as I mentioned earlier, this can also be used by the business associates to manage any downstream vendors. So the covered entity or the business associate has the latest HIPAA certification status and the documentation for all of their downstream business associates and vendors at all times. And once the assessment has been done, one cycle of it, the tool will then continuously monitor, and you will have the ability to keep track of the compliance status of every downstream BA, and you can do notifications, you can escalate issues if need be to take care of that. So what the Aegify Business Associate Manager is doing is creating a very complete unified framework which allows you, your BAs and subcontractors to collaborate using an automated means to establish the current certification status. You can exactly monitor where they stand, what's pending, who are coming up for renewal, and you can manage all the documentation such as business associate agreements and HIPAA certification documents for every business associate and vendor. And if need be, you can escalate and provide corrective actions to the respective BAs and vendors so that they can follow up and close any gaps that were found. So all of this is provided through dashboards and reports that I'll show you in real time. So now let me switch gears and show you what the solution looks like in a over the next few minutes. So this is the dashboard that the covered entity or the BA would see, and it kind of shows you the complete oversight view of all the business associates that work with me. So in this case, I'm a covered entity, and I have 10 active business associates. And the top row tells me how many of the BAs are past certification due. So they are not compliant right now. Some of them are coming up for recertification. So I need to be aware of that, and the system will automatically notify the BAs to take steps to meet the date. Some of the BAs are going through a process of assessment, remediation, which is fixing problems, and some of them are pending attestation. And there are a number of new BAs that have joined the company. So I have a count and status for every BA that I'm working with. And if I want to invite any new BA, I can do that right here. I can fill in the form, and the system will pre-populate that email with content so that you can invite other BAs in your environment who need to comply, and so that you can bring them in and then manage them through this framework, through this tool. So now I also have a graphical representation of all the BAs that I work with. I can filter based on who's compliant, who's non-compliant. If I look at non-compliant BAs, I can click on the map. It's an interactive map, and it tells me that this particular BA, which is Micropoint Bioscience, located in Illinois, is non-compliant. and that's because there are a number of security and compliance issues. So as a covered entity, I get a summary view of all the open issues that are found. I clearly cannot get anything more than what the business associate is sharing with me, which is a summary status. So the tool allows you to essentially manage all your BAs. You can create a hot list of BAs that that you want to focus on. That might be either non-compliant, or this could be the list of BAs that are very critical to you. I also have the ability to look at all the BAs that I work with. In this case, all the 10 BAs are shown here. I can search based on names. I can search for the BA agreements that are there. I can look at the status as to what some of them are certified, some of them are going through different stages of assessment and remediation. So it's again a complete tool, complete interactive tool that allows a covered entity or business associate to manage the state of their downstream BAs and vendors. There's going to be alerts and notifications that will pop up here if there's certain actions or escalations that you made but have not been followed up. That will be shown here. So this is on the covered entity or the business associate manager side, where you're trying to manage the downstream BAs. We similarly have a module that is on the business associate side. So if you recall, the workflow or the use cases that the covered entity or the business associate invites the BAs, downstream BAs, to show or prove their certification status. So in this case, once a business associate gets the invitation, if they're already compliant, they attach the proof of their certification. If not, they can use the tool to go through different stages to become certified and compliant. So what I'm showing you here is the steps that the business associate would take, and it's a wizard-driven approach. There are multiple stages to achieve before the business associate can be certified. So when you log in as a business associate, you will see a dashboard that tells you your current status. The wizard is like a TurboTax wizard, will ask you a set of questions about your organization. Based on that, there'll be a set of assessment questions that will be asked to you. And these assessment questions pertain to the HIPAA Omnibus requirements, and you can answer them yes or no, upload evidence. There is a knowledge base here that's included in the tool that gives you information to answer these questions. There are embedded policy documents that you can use to understand what the requirements are and what should be done in the business to follow the HIPAA requirements. So the knowledge base is aiding the user to answer all the questions to the best of their knowledge, and the policies and procedures could be used as evidence to prove that they have complied with it. Then they go through a process of network scan, which is required for all IT assets that they be scanned for vulnerabilities. And once they do that, then they can go ahead and review and the status and attest it. So right now it will not allow me to go because I haven't finished the assessment questionnaire. But this is the pain. Once I fill in all the questionnaire, I'll be able to review and then share the status with other downstream BAs and covered entities. So what we are doing really is to look at the BA and vendor management problem end to end, starting from the upstream covered entity down to the next level of BAs, and for those set of BAs, we provide a capability to manage any downstream BAs and vendors. So the entire supply chain, entire liability chain is being managed using the BA management tool that we have built. So that's a quick demo. And do you want to run a quick survey before we go through the next slides, Alex?
Yeah, no problem. Just give me 2 seconds. We actually have a question from one of the attendees wondering if this is an upgrade to the current version.
Yeah, so we can take up the question at the end, if that's okay.
Okay, the poll is launched. Has BA/vendor management become a higher priority in your organization, yes or no? Okay, I'll close the poll now, and 50% say yes and 50% say no.
That's interesting. So it will be good to hear from the other 50% who said no as to why this is not a priority. So that will be good to hear about. So before we jump to the questions, in closing, what I would say is that this HIPAA enforcement and HIPAA compliance and certification is very critical. As we know that Office of Civil Rights is putting a lot of resources to do the audits. It's going to happen this year, and BA vendor management is a huge problem. This was articulated by the Office of Inspector General at the SCCA conference a month ago as well, and so there needs to be a way to proactively manage business associates and vendors. And Aegify Business Associate Manager has been designed from the ground up to address that problem. And we would also like to get some feedback from the people who said no as to why isn't this a problem as you see it. Now, performing security, sorry, Alex, you were saying something? Okay. Performing security risk analysis is clearly required, and this is part of the holistic requirement, and business associate management adds and contributes to the overall risk assessment that covered entities would do. So it's not something that you can ignore without managing your BAs and vendors proactively. And you can use Aegify to deal with all of your HIPAA high-tech issues and be ready for an OCR audit. So that's the presentation. Let's now jump to the questions and answers. Please type in your questions, if any, in the Q&A section of the GoToWebinar tool.
Okay, Anupam, we've got one question here wanting to know if this is an upgrade to the current version.
So you want to answer that, Tom or Alex?
I will answer. I'm not sure what the question is coming from. Is it someone who's a current PolicyMedical client?
Tom, it's a little hard to hear you, but I think your question was, where is this question coming from?
Is this a question from someone who's a current PolicyMedical client?
It doesn't specify.
Okay. For those who are PolicyMedical clients who are on this call, it is a new feature that's available to our clients as a upgraded module. It does come at a cost. And for those who are familiar with the Aegify suite of SRC solutions, this is another feature that has been added to the program as well. And if you'd like more information on that, or would like to schedule a demonstration of the system, you can certainly go to the links that you see here, and we'll respond to you and set that time.
So there's another question. Is it a cloud service that doesn't access PHI considered a BA? So is this a cloud that doesn't access? Is a cloud service that doesn't access? No. So if you're a cloud service and you do not handle PHI information in any form, and the handling of the PHI could be either that you're accessing the information, you are viewing the information, or storing it, or transmitting it. So if you do any of these functions, then you are considered to be a BA. If you do not handle PHI information in either of these through either of these actions, then you're not considered a BA.
And Anupam, just as a note, on a more macro scale, the Office of Inspector General take this even further to say that organizations should be doing risk analysis on all of their assets. HIPAA and Omnibus are specific to just PHI data. However, entities are more secure if they're making sure they're doing this across all of their assets.
That's correct. So if you want to security harden your organization beyond just the PHI information, I want to reinforce what Tom said is that it's important that you do a risk analysis of all of your critical assets, which could include PHI critical assets as well. And that would make you more secure. That will tell you what the open issues are, what the security gaps are, and then you can fix those problems to manage your risk liability. So doing a risk assessment for any organization is very, very critical and very important so that you know where you stand today. So the follow-up question was that if the cloud is storing PHI, it is a BA. Correct. That is correct. The answer is yes. If you store PHI, then clearly you have the responsibility to handle PHI um, to protect and secure it. Okay, so there was one more question. Is there any guideline as to what a CE needs to verify BA is HIPAA compliant? So the covered entity needs to ensure the business associate is HIPAA compliant. And it's the responsibility of the covered entity to be proactive to assure that. So earlier you could just have a business associate agreement where the BA would say, yes, I'll follow the rules required by HIPAA and do nothing about it. And the covered entity could shift the responsibility and the liability to the BA because they had a BAA in place. Now that's no longer true. So the covered entity now has to be proactive to audit, to do HIPAA certification, to make sure that every business associate is HIPAA certified. And so what we provide through the tool is to automate that entire process of assessing, validating, and monitoring that all of the BAs are indeed HIPAA compliant and certified.
Correct. And Anupam, to add to that, there have been CEs who have actually been able to relieve themselves of certain liability by demonstrating that they've taken action to try to make sure that their BAs are in compliance. And that is where, again, this tool comes in place to have a trail of your proactive response to making that happen. And using the tool to make decisions about how you manage and work with that BA, perhaps in the future as well.
Right.
So this type of tool actually provides a lot of risk mitigation for the CEs because they do have documentation and trails that show that they have taken appropriate steps to try to assure that compliance with their BAs.
Right. Yeah, so that's a very critical point. So there's something called willful neglect, which is at the highest, which causes businesses to be fined at the highest limit. And if you use a tool like Aegify, then you have made reasonable efforts. Even if you get audited and you're found to be not compliant for some other reason, just because you're using a tool, it shows reasonable efforts, and the fine category is at the lowest level. So the fact that you're worried about this, you've taken reasonable steps and measures to manage your BAs goes a long way to demonstrate that you are worried about this issue and you are managing the BAs proactively. So that particular item would be in your favor, big time. So another question is HIPAA certification an Aegify term or an HHS term? So HHS does not do any HIPAA certification. It only lays down the audit protocol requirements which they would use to audit any organization. So HIPAA certification is really a term that that we use to state that if you follow these different steps, then you will meet or exceed the OCR HIPAA audit protocol requirements. So you will essentially be able to show that you are HIPAA compliant. You'll have audit trail that also can be shared with the Office of Civil Rights to demonstrate your efforts that you made and the proof of compliance. So it's a term that says that you meet all the requirements, exceed it, and it gives you peace of mind. Okay, so I think looks like there are no other questions. So we would like to thank you all for coming, and please provide us feedback on any other topics that you would like us to cover, and have a great day.